Hey, welcome to my Freedom from Suffering Now vlog. I'm Dr. Steve Grinstead. Today, I want to talk about how to help friends or loved ones who are suffering with chronic pain. This is a big challenge. We get so many calls about this all the time. I get a lot of calls from people in pain, obviously, but a lot of times it's their friends and family members who are calling and says, I don't know what to do anymore. I'm feeling hopeless. I'm feeling helpless. I don't understand this. How can I help? And unfortunately, sometimes they try to overhelp. It's the kill them with kindness syndrome. So, if you have someone in your life that you care about who is suffering with chronic pain, just listen to me for a few minutes here and see if this makes sense for you. First of all, it's really important to try to understand what this person's going through. And if you've never lived with chronic pain, that's going to be very challenging. But here's how you might be able to go about it. I would invite you to think back to a time when you were hurt or injured, like, you caught your thumb in a door, you stubbed your toe, for women that have done childbirth, whatever it is, you broke a bone, you had a very painful medical condition, a toothache, a big bad headache, whatever it is. Picture a time when you had some really severe pain that was really intense. On a 1 to 10 scale, let's say it was up at an 8 or a 9 or even a 10. Now, once you get that snapshot in your head, try to take yourself back to that pain. It's going to be very hard, but you can do it if you give it a shot. So once you imagine and remember what that pain was like, then see if you can imagine what it would be like if you had to live with that 24/7 for 6 months or more. It's really important to really try to understand what the person's going through. And also, I believe that people who are suffering with chronic pain need to be active participants, not passive recipients of treatment. So what are you seeing? Are you seeing some areas when you're trying to do things for them they should and could be doing for themselves? If so, back off. Sometimes people do need help, absolutely. It's also important to help the person, give them some resources. One of the resources is, there's a lot of resources on my freedomfromsufferingnow.com site. A whole lot of things on there that are free. There's some that are very low cost. If you go to the articles page, there's a lot of articles. Matter of fact, there's one about you, family and friends of people suffering with chronic pain. There's also how to deal with chronic pain when you have other issues going on, depression, trauma, addiction, etc. On my bookstore page, my book, Freedom from Suffering, A Journey of Hope, that might be something awesome. If the person's in recovery or has a problem with medication management, they might better benefit from my addiction-free pain management recovery guide. A lot of resources there. And also on the events page under webinars, I've got some free webinar there and some low-cost ones. So there's a lot of resources. The first step towards solving a problem is understanding what the problem is and then what it takes to get into the solution. And you can be an advocate for your loved one who is suffering with their chronic pain. The other thing is, it's really important to tell them that they don't have to suffer. There is a way out. I offer people a free 15-minute consultation when they sign up on our homepage of freedomfromsufferingnow.com. I want to get the word out that there is hope for people. It is possible. The other thing, if you have a friend or loved one, you need to be practicing really good self-care yourself. I know how important that is for me. I need to take really good care of myself in order to be of service to others. And I do that in 4 areas. I take care of my physical health, diet, nutrition, exercise. I do that with my psychological self. I'm always trying to challenge negative, self-defeating thinking patterns. When I have uncomfortable feelings, anger, fear, stress, anxiety, loneliness, whatever it is, I need to take a time out, put myself in time out, do some deep breathing, maybe go for a walk, maybe play with the dog. So I need to practice some really good psychological balance. Then the next area is my interactions with friends, family, and community. Sometimes caregivers, as well as people suffering with chronic pain, tend to isolate. So it's really important to reach out. It's also important to set realistic limits and boundaries with other people. It's crucial to have a support for yourself. You know, Al-Anon, CODA, these are good support groups that are free for people. The person with pain should be going, say, Chronic Pain Anonymous groups or chronic pain support groups. If they have trouble with medication, they should be going to Pills Addicts Anonymous support groups or Narcotics Anonymous, something like that. So it's getting the message out that there's always hope. So that's the social area. It takes a team. When I work with people, I help them develop a team of coaches and guides, both professional and personal, to help them on their journey. Well, when I work with family members, I do the same thing. Who are 3 accountability partners, 3 appropriate people that you can call on to support you so you can get some nurturing? And then finally, the last area is the spiritual. Not religion, but spiritual. Here's where it's really crucial for me to be in touch with what are my spiritual values, principles, and practices. How congruent are my behaviors with my principles and my values? And when it's not, I need to take action. You know, for me, the spiritual is also going into nature. It's doing meditation. It's calling someone and talking at a deep emotional, spiritual level with them. There's a lot of different things people can do. So again, if you have a friend or loved one who is suffering with chronic pain, the first step is to take care of you first. You know, I fly a lot, and I'm always hearing the announcements when we're getting ready to take off. And one of them is, if we lose cabin pressure, there's going to be a mask drop down. We highly recommend you put your mask on first before you help someone else. Because if you don't put your mask on first, you're not going to help someone else. So I'm asking you, put your mask on. Get your levels up biologically, psychologically, socially, and spiritually. Practice some good self-care. Set some good limits and boundaries. And also, you know, ask the person, what can I do to support you? Rather than trying to figure it out or trying to mind read them. And most importantly, never do something for someone they can and should be doing for themselves. It's disrespectful to you and to them. I hope this was helpful. And again, this is the latest in my series of how-to vlogs. And this one is about friends and families and self-care. And it's all about taking good care of self. So I really appreciate you being with me today. And if you have any ideas or suggestions for future vlogs on how to, please, let me know. I'm going to do at least one a week, sometimes more, because I really want to help people. I want to let you know that there is always hope. While we breathe, there is hope. And I also believe that freedom from suffering is very possible. And it's a right and a responsibility. And believe me, friends and family members suffer every bit as much as the person living with chronic pain, and you don't have to. So practice good self-care. Thank you for being with me today, and onward and upward.